The Boston AF Symposium was conceived in 1995 in response to the growing epidemic of atrial fibrillation, and at that time was kind of an orphan disease in the sense that electrophysiologists did not have a great deal to offer nor a high level of interest in the problem. But what was obvious to everyone, I think, was that this was becoming a worldwide epidemic. We started the meeting with the idea that we would cover in as comprehensive a way as possible what was happening in the field and do it in a relatively intimate environment with a group of attendees who had a special interest in atrial fibrillation, who could spend time together in one venue, one room, with a group of faculty in a very interactive way, talk about the current state of the art of the field, both from a basic science and a clinical science perspective. It evolved into a much larger undertaking, but what didn't change was the basic concept, which was this was a meeting that you could go to and gather with other people of like interest and an extraordinary international faculty for a few days, sit in one place, and hear everything you wanted to know about atrial fibrillation over the course of a few days. What we did ultimately was evolve to an integrated format where we have a lot of basic science around things like remodeling, fibrosis, inflammation, impact of obesity, a variety of other basic science questions, integrate those with clinical talks so that we have theme-based sessions throughout the course of the 3-day meeting. We implemented satellite case transmissions as a very important part of the meeting, and that has continued. In fact, it has expanded with regard to the amount of time and energy and the size of that effort at each of these meetings. So we now have a variety of cases that are done during the course of the meeting from international centers on topics of major interest, typically in the treatment of atrial fibrillation. The vast majority of these are related to ablation of atrial fibrillation or mechanical approaches to stroke prevention. In addition to the satellite cases, we also have had pre-recorded cases which provide a different kind of teaching opportunity, but equally interesting to attendees. I would say that the major focus, however, has been on having integrated sessions that have both basic and clinical science organized around specific themes, where there was very basic science to present, but also associated clinical science. And it gives the attendees and even the faculty, because there's a lot of interaction during these sessions between faculty and audience, a chance to discuss in a very open way new ideas that come up during the course of the presentations. And that creates a kind of dynamic environment that's very difficult to get at huge meetings. And this meeting, being on a relatively small scale, provides the opportunity for that kind of interaction, and it can be very exciting both for the faculty and for the audience. One of the other main focuses of the meeting has been to update the audience on ongoing and recently completed clinical trials. So the topics range from very basic science to clinical science, new technologies, applications of basic science to clinical activities, but also a lot of discussion around clinical trial data. And much of this relates to stroke prevention, but also to new approaches to the treatment of atrial fibrillation. Those presentations are typically made by individual investigators who are engaged in the trials themselves, but also the interpretation of these studies in terms of what they mean for clinical practice. How should they be applied? Are there populations to which these trial data don't apply? And we spend a lot of time in those sessions, but also in the case discussions, looking at individual problems or cases where the data don't always get you the answer, and where it helps to listen to a variety of experts from all over the world talk about their approaches to very complex problems for which we don't have perfect answers. one of the other advantages of this meeting, which brings together a faculty, international faculty of somewhere between 40 and 50 experts, these are the leaders in the field, is that it provides the audience with an opportunity to hear how the highest volume, most experienced operators are performing procedures in their labs today. And as you know, this can be a very complex field in terms of the wide array of mapping systems and other technologies like contact force sensing, temperature, a whole host of esophageal monitoring tools, or all sorts of things that may be used during procedures to optimize both efficacy and safety. And understanding how the current experts in the field from all over the world use these various tools and how they weight them and what they use to actually guide their procedures is invaluable, because much of this is practical knowledge and is not something that's available in the literature. So a great deal of what gets discussed around specific cases, for example, is not something that one can find in the literature. It's something that has to come from the horse's mouth. And one of the goals of this meeting is to gather the most experienced high-volume operators from all over the world to share their experience, share their best practices, address practical questions of how to do procedures with existing technologies in a way that maximizes the likelihood of a favorable outcome, but also maximizes safety.